student. Okay? Clear ba, student? Clear na.
Yes po, ma'am.
Yes.
So the rest, you take down notes and take your seat and listen. Okay? I want you also to participate because I will also ask you as a participant. And then you can also ask question. Siguro sa each group, merong isa-isa mag-question sa nag-present para may role naman kayong participant. Okay? Sige. Miss Calios.
So good morning, everyone. We are the group 1. So for the infant, the one who will present is Andy Barroso and Christina Concepcion. And then for the toddler, the one who would present is would be Batiao, Arubio, and then Kagampang. And then for the preschool, the one who would present would be me, Calios, and then Britannia. And then for the school age would be Arsenio and Advincula. So for the infant, let me call on Christine Concepcion.
Hello, am I audible?
Yes po.
Okay, thank you. So I am student nurse Christine Arana Concepcion, and together with me is student nurse Daniel Barroso to discuss about infants. Wait, sorry. So to discuss our case about infancy. So the stage of infancy falls within the range of 1 month to 12 months. In this age, there are noticeable growth in development where they learn to smile, crawl, pick up objects, walk, and talk. In this stage, cognitive development is evident because this is where they learn to utilize their reflexes.
Excuse me. Can you kindly stand para makita yung body and try to fix all your cams now so that I could see you. Diba, I told you to prepare. I don't want you to read. Okay? I don't want you to read, student, kasi I'm also reading your manuscript. So, I will know if you are reading. Kung mag-read, glance lang yun na, because I want you to show mastery. Okay? So, I have your manuscript, so I know if you are reading the whole manuscript. Sige.
So again, this is the stage where they learn to explore their surrounding. So social and emotional behavior also develops by trusting and interacting with the environment, which is crucial to the infant's growth and development. That is why it is important to understand this behavior by this theory to explain the aspects of human growth to help track the development of the infant. So one of the theory is the Erik Erikson psychosocial theory. It focuses on the trust and mistrust stage where the infants develop basic trust when their needs is consistently met. This is an important factor for the healthy development of the child and building trust with their caregivers. This also leads to exploration in Sigmund Freud's psychosexual theory, where it is stated that infants are in the oral stage where the infant enjoys oral activities such as tasting, chewing, and they enjoy putting things in their mouth. Meanwhile, cognitive development is discussed in Jean Piaget's theory. Infants explore with their surrounding using their senses during the sensory motor period. Infants develops object permanence, where they know that a certain object exists even if it is hidden. The anxiety is also part of this development, where the infant express distress around unfamiliar people and tends to seek to seek out the familiar, which is usually their caregivers. Um, so all of that were assessed using the Metro Manila Developmental Screening Test to note for normal growth and detect developmental delays. This test evaluates the four aspects of the child's development: the personal social sector, the fine motor adaptive sector, language sector, and gross motor sector. We also examine the infant's immunization down to the birth history of her mother to note for several changes that corresponds to the expected change during infancy. So our client is JBS, who is a Filipino infant who was 9 months and 23 days old when we conduct our assessment on October 25, 2022 rather. She was born on December 22, 2001, and she is the youngest among three siblings. We choose our client because she fits the criteria of a 9 months old infant who is accessible, because the client lives in Comunal, Davao City. So infants develops their own pace. However, developmental milestone is important to keep an eye on to ensure steady development. Unfortunately, we are unable to find any statistics about imitating speech sounds in the language sector and holding onto furniture in the gross motor sector. So, Ms. Barroso.
So next slide, please. So for the objectives of the manuscript, the general objectives, the student nurses will be able to conduct a physical assessment to examine for any abnormalities with the infant's general health and administer the Metro Manila developmental test to assess the child's growth and identify any delays in her personal, social, fine motor, adaptive, language, and gross motor development. Next slide, please. So for the specific objectives, at the end of the 2-hour assessment, the student nurses will be able to establish rapport with the client and her caregivers, collect needed information about the client and the mother, perform a cephalocaudal assessment on the client, administer all the MMDST items appropriate for the client's age, identify any delays and advancement in the MMDST result, and lastly, to provide health teachings helpful to the client. So next slide, please. So for the personal data of our client, so we must note that our client is a 9-month and 23-day-old infant at the day of the assessment, which was conducted on October 15, 2022. So she lives at Comunal, Davao City, which made it easier for the student nurses to assess her because she is accessible since she lives in Davao City. So her birthday rather is on December 22, 2021, and she is the youngest among 3 siblings. She's also Filipino and a Roman Catholic. So her father, JS, is a 48-year-old man who is a college graduate and currently works as a social insurance assistant. Then her mother, Casey, is a 31-year-old woman is a college undergraduate and works as an area coordinator. So for additional information, they are a cohabiting family since both of them aren't married yet. So next slide, please. So for the MMDST, so for the computation of age, the date of the assessment was on October 15, 2022, and the client's birthday is on December 22, 2021. So to compute the age, we added 30 plus 15, which is equals to 45, and then we minused it on the birth date, which is 22. So we had 23 days. So for the month, since we borrowed one number, so 11 plus 10, we have 21, and then you minus it with the birth month, which is 12. So we have 9 months. So for the year, since we borrowed another number, so 2021 minus 2021 is equals to 0 years. So our client is a 9-month and 23-day-old baby at the time of the assessment. So next slide, please. So for the description of the test frame, the student nurses drew the age line at the MMDST form, and the items that were touched by the line were those that we administered to the client. So all in all, we have 30 items administered, 6 from the personal social, 6 from the fine motor, 7 from language, and 11 from the gross motor, in which she passed 18 items and failed 12 items. So even though she had failed 12 items, there were no delays since the tasks she failed were on a higher age. That means she can still develop those skills. So the test requires 3 fails and 3 passes and 3 failures. So in order to gain 3 passes, the student nurses moved to the left side of the test, and in order to gain 3 failures, the student nurses moved to the right items of the form. So next slide, please. So for the personal social sector, this sector our task consists of tasks which indicates the ability of the child to interact with others and to take care of oneself. So the test items include plays pat a cake, initially shy with strangers, feeds a self cracker, indicates wants without crying, plays ball with examiner, and imitates housework. So for this sector, only one item was touched by the age line, which is plays pat a cake. So we move to the left to gain another 2 passes, and we move to the right to gain 3 failures. So for plays pat a cake, this was passed by report. So the student nurses asked the mother if the client is already able to wave bye-bye without touching the arm or touching the hands of the client, and the client passed this item since the mother verbalized nga kabalo na siya mag-wave pero up and down lang. So she cannot wave like this, but she can wave like that. So the rationale of this is that at the age of 9 months, the baby or the infant can now start waving, but they can try waving.
Report ko.
They can
Oh,
try.
sorry.
So they can try waving, like flapping their arms up and down. So next is initially shy with strangers. So in this item, this was also passed by report. So we asked the mother if the child changes her behavior in front of people she isn't familiar with compared to the people she knows. So she also passed this item because the mother verbalized nga dili pa ni siya gapagunit sa mga dili niya kaila niya magdikit rin siya sa akoa. So the rationale behind this is that at the age of 6 months to 6 years, they are naturally shy, and it is part of their character and how they respond to the outside environment, so which is normal. Then next is feeds a self cracker. So this was also passed by report. We asked the mother if she's able to feed herself biscuits, crackers, or a cookie, and she also passed this item since the mother verbalized na the mother verbalized nga gakaon na siya hatagan na mo na siya og biscuit katong Marie. So Marie is a soft cracker that easily melts in their mouth. So the rationale behind this is that starting at the age of 6 months, when they start to swallow, or they are already able to self-feed. The next is indicates once without crying. So this was also passed by report. We asked the mother if the infant can already point, pull when she wants something. So the client failed this item since the mother verbalized nga dili pa na siya kabalo mo hilak ra na siya og na siya kailangan or kung gigutom siya. So the rationale behind this is that at the age 12 months to 18 months, that's the time or that's the age when when a child learns how to point when they want something. So next is place ball with the examiner. So when we administered this, we rolled a ball to the client, hoping that she will roll the ball back. So she failed this item again since she wasn't able to roll the ball back to the examiners, since she just attempted to put the ball in her mouth. So the rationale behind this is that at the age 8 months to 1.5 year old, that's when the child can develop the skill in rolling the ball back to the examiner. So since this is not a delay, since she can still develop the skill when she's 10 months, 11 months, and 1 year old. And next is imitates housework. So this was passed by report since we asked the mother if she is able to imitate housework such as sweeping and dusting. So she also failed this item since the mother verbalized nga dili pa na siya kabalo kung ano na siya ga kaon ga dula sa ilahang balay. So the rationale behind this is that toddlers are at the age of 2 years, toddlers can already imitate houseworks made by their parents, such as doing laundry, sweeping, mopping, and that's why she failed that item since the age bracket for imitating housework is 2 years old, which is a toddler. The next is the fine motor adaptive sector. So this sector consists of items that indicate the child's ability to use their hands, to draw, and to see. So the test items includes neat pincer grasp, bangs 2 cubes held in hands, thumb finger grasp, scribble spontaneously, and tower of 2 cubes. So 3 items were touched by the age line, which is neat pincer grasp, bangs 2 cubes held in hands, and thumb finger grasp. So for the neat pincer grasp, we placed a cheese curl in front of the client, which is within the client's reach, hoping that she will grab the cheese curl. So she passed this test since she grabbed the cheese curl using her thumb and her index finger. So the rationale behind this is that starting at the age of 9 months to 12 months old, that's when the skill of knit pincer grasp can develop to a child. And next is bangs 2 cubes held in hand. So the examiners put 1 cube in each of her hands, and then we encouraged her to bang the cubes together by demonstrating how. So she passed this item since she after a few seconds or a few moments she banged it together. So she banged the cubes together. So the rationale behind this is that at 9 months old they can start using their hands to bang objects to create sounds. The next is thumb finger grasp. So this is similar to neat pincer grasp, but the thumb finger grasp is when the infant grasps an object using their thumb and any part of any finger. So we dropped the cheese curl within the client's reach, and then she passed this test since she was able to grab the cheese curl with her thumb and with her index finger. So she still used the knit pincer grasp. So the rationale behind this is that at 6 months old, an infant can already use their thumb in holding objects while using their fingers as to grasp the object. The next is scribble spontaneously. So the examiners put a piece of paper in front of her, and we also provided her a pencil. Excuse me. So there should at least be 2 markings in the paper, but unfortunately, she failed this item since she only toyed with her pencil, bang it on the table. So the rationally behind this is that at the age of 12 to 15 months, that's when the child can start to hold a pencil properly, can color or can scribble. The next is Tower of Two Cubes. So we placed blocks in front of her, and then we demonstrated how we encouraged her to stack 2 cubes by demonstrating how. Fortunately, she also failed this task since she only attempted to put the blocks in her mouth or just bang the objects together. So the rationale behind this is that at the age of 12 to 16 months, that's when an infant can develop the skill in putting a tower of 2 cubes. Then the next is Tower of 4 cubes. So again, we encourage the infant to stack 4 cubes together without them falling apart by demonstrating how. And again, the infant failed this item since again she just attempted to put the blocks in her mouth or to bang the items or the cubes together. So the rationale behind this is that at the age of 18 to 22 months, that's when the infant can start to stack 4 cubes without them falling together. The next slide, please. So for the language sector, this task includes items. This sector includes tasks that indicates the child's ability to communicate, to hear, and to follow directions. So the task items include Dada or Mama specific, imitate speech sounds, turn to voice, squeals, laughs, 3 words other than Mama and Dada, and combines 2 different words. So there are only two, or I'm not sure how many I'm not how many items were passed by the line, but there are items that there are items that we move to the right so that we can gain 3 fails, and there are items that we move to the left to gain 3 Then so first is Dada or Mama specific. So this was also passed by report since we checked or asked the mom whether the infant is already capable of saying Dada or Mama without interchanging the words. So, but also during the assessment, we observed that the infant kept on saying Mama to her mom. So, but since the dad wasn't present, we asked the mom if the infant is able to say Dada to the dad. So she passed this test since the mom verbalized nga, oo, kabalo na siya. So for the rationale of this is that at the age of 9 to 12 months old, the baby can identify or distinguish between the mom and the dad. The next is imitate speech sounds. So this item, this was passed by the age line, and that she failed on this item since this was also passed by report. So we asked the mom if she's able to imitate speech sounds made by them, and we also tried to check if she would follow us. So during the assessment, we tried to say hi, but she only looked at us. So we asked the mom if she can imitate their sounds, and she said dili pa na siya musundog sa kuan per makastorya na siya. So which is considered as a failure. But so the rationale behind this is that starting at ages 6 months to 11 months, that's when the child can imitate speech sounds. But this is not a delay since she can still develop the skill when she's 10 years to 11 months old. So since she failed, we moved to the left we moved to the left and administered 3 more tests. So next is to turn to voice. So in administering it, we called or we mentioned or called or mentioned the infant, called her name several times behind her, and of course without making sure that our breath doesn't touch her ear or like that. And turns to voice. So she passed this item since she was able to look at the direction where her name was called. So the rationale behind this is that at the ages 5 to 6 months, an infant can already respond to their name and can also look at the direction where where a person is speaking. So for the next items, let me call on Christine Concepcion.
So thank you, Ms. Barroso, for the continuation of the language sector. Next item is the skill. This was passed by report because the student nurses asked the mother if the child can make a high pitch squealing sound, and the mother verbalized that oo, og ma-excited siya, magsaba-saba siya. It is stated that infants between 7 to 9 months uses sound to express or communicate with their caregiver, and they tend to imitate the noises they hear. Next item is the laugh. This was also passed by report. The student nurse asked the mother if the infant can laugh loudly without being tickled, and the mother verbalizes that the child laugh, labaw na og hagwaon. Most infants in 9 months reach the milestone to smile and laugh when you play peekaboo, as well as display facial expression. Next is the 3 words other than mama and dada. This was scored failed because according to the mother, the child still doesn't know how to speak different words other than mama and dada. Majority of this age still doesn't know how to talk, and most of them are still babbling and practicing pronouncing vowels. Next item is the combines 2 different words. We asked if the infant can say 2 words and combines them if she wants something, and it was scored failed because according to the mother, di pa na siya kabalo og lain, or di pa na siya kabalo mag-ingon og lain words, and maglangi ra na siya kung naa siya'y gusto. So the rationale behind this is between 18 to 24 months, the child should be able to link words together by expanding their vocabulary. So since she's still in the 9 months, so she is not considered delayed. So next item is the stand momentarily. This was scored pass because we asked the mother to place the infant on the floor and slowly remove the support when the child gains balance. At 9 to 12 months, infants can initially stand for at least a few seconds. When they reach 13 to 15 months old, they may stand or they can stand independently. So next item is the hold onto furniture. This was scored failed because we asked the mother if the child can walk while holding onto furniture. And the mother said that the child or the infant could still not walk. So babies may begin to stand and hold onto furniture to explore at around 9 to 12 months old. So she still has a few months to practice. Next item is to pull to sit. This was scored passed because we asked the mother to place the child on her back and place it on the bed and slowly pull the child into sitting position. So the child passed because the head of the child did not hang while she was being pulled. So infant can be supported while sitting by the time of their 4th month, and by the 7th month, they should be able to sit without support. So the next item is bear some weight. This was scored pass. We asked the mother to place the child upright on the table and gradually loosen the support. So the client or the infant was able to support her legs and stand momentarily on her own before sitting down. So by the 2 and 4.5 months, some infant can bear weight on their legs and stand with support. So next item is to stomach head up 90 degrees. So it was scored pass because the child was able to lift her head into 90 degree position when we asked the mother to place the child on her stomach on the bed. So the rationale behind this is at 4 months, they may be able to lift their head into 90 degree angle and adjust their weight. So next is to sit without support. The student nurse asked the mother to place the child into sitting position, and we scored it pass because the infant was able to sit on her own for at least 8 seconds before crawling back to her mother. So the rationale behind this is by 6 to 8 months, they learn how to sit independently, and by 9 months, they should be able to get themselves into sitting position. So next item is to stand holding on. It was scored pass because we asked the mother to place the child into standing position with the support of the child's crib. So we passed it because the client was able to stand for at least 5 seconds before sitting down. So the rationale behind this is by 7 to 12 months, the infant can support their weight on their legs when being held up with their feet on the ground. So the next item is pull self to stand. It was scored pass because we observed the client if she was able to pull herself to stand on her own by placing her in a sitting position inside her crib, and she was able to pull herself to stand while holding the crib for a short amount of time without assistance from us or from her mother. So by 7 to 12 months old, they typically start pulling themselves to stand rather, and hold on to any support such as the furniture or the hands of her caregiver. So next is to get to sitting. The student nurse check if the client is able to sit by herself, and it was scored pass because we observed that the client could sit without assistance. So the rationale behind this is at the age of 6 months, the client could sit with little assistance and could sit independently by the age of 7 to 9 months old. So the next item is stands alone well. The student nurse asked the mother if the infant could stand for more than 10 seconds, and it was scored failed because according to the mother, the infant could only stand for 4 to 5 seconds, and we observed that she could not stand on her own well. So most infants could stand unsupported by the time of 10 months to 1 year and be able to stand using their hands by 11 to 14 months old. So for the last item, we have stoops and recover. So this was also scored failed because we asked the mother if this child could pick a toy while standing without support. Um, and she said that she still can't stand on her own without support. That's why she can pick a toy while standing. So the rationale behind this is usually a child could pick a toy while standing when he is by the age of 2 years old. So for the interpretation, the MMDST results are normal. There were no indicators for developmental delays and was able to perform the task in accordance to her age. So 6 items were administered in the personal social, also 6 for the fine motor adaptive, 7 for language, and 11 for gross motor sector. So all in all, it was 30 items. So the result showed that she failed 12 tests coming from the right side, and and it was not an indicator for delay because those tests are for advanced items, and she could still pass those when she reached that specific age. So for the personal social, so one item was touched by the age line, which she passed along with 2 more items on the left. She also, since we need 3 passes and 3 failed, we moved to the right side and she failed those tests which were advanced items and not an indicator for delay. So for the fine motor adaptive, she passed 3 items which was touched by the age line. So we moved to the right side, and she failed those items, which is also not an indicator for delay because she can perform those when she reached that specific age. So for the language, 2 items were touched by the age line, 1 pass and 1 fail, which means we need 3 more items on the left. And she was able to pass the items on the left side. So in total, there were 4 passes. So 2 items from the right were also tested because, and she failed. She failed those items which are for advanced age. So lastly, for the gross motor, 6 items were touched by the age line, 5 items were passed, and 1 failed, which means we need more 3 additional items, and she passed them all on the left side. So in total, there are 8 passes, 2 items from the right will tested, and she failed those test items. This also does not an indicator for delay since she can pass this months later. So Ms. Paroso.
So next slide po. Next is for the general observation. So first we started with maternal obstetrics and prenatal history. So the age of gestation is 39 weeks, which is not premature. She has a gravida of 3, para 3, term 3, premature 0, abortion 0, and 3 living. So during her entire pregnancy, she only visited the healthcare for 5 times, and she also had complications during her pregnancy, which is the post-hemorrhage, and she had an open cervix at 6 months. So the physician prescribed her medicine, which she did not remember the name of the drug, and sa post-hemorrhage is that postpartum hemorrhage, they just cleaned her. The next is she is already vaccinated with 5 tetanus toxoid, and she was also prescribed medications such as supplements, calcium, folic acids, ferrous sulfate. She labored for 8 hours, and she had a normal delivery and with the use of anesthesia. So number 2, the birth history. She had a normal delivery and she delivered at SPMC and with a cephalic presentation and the birth weight of 2.8 kilograms. So when asked about the height, she wasn't able to recall the height of the baby. Then next is the neonatal. So the baby underwent newborn screening at SPMC, and fortunately, thankfully, there weren't findings or any complications, and they stayed at the hospital for 4 days, and she wasn't also prescribed for any medications. And next is infancy and childhood. So she didn't acquire any of the childhood diseases, and she is also completely immunized except for the IPV and the MMR. So the student nurses gave them health teachings about this, which will be expounded later. So the mother also mentioned that she is allergic to a food, which is adobong atay sa manok, and where she was sent to the hospital, but only as an outpatient because she was already turning red. So the physician prescribed her cetirizine to relieve the allergic reaction. And so far, she has no serious injuries and no congenital problems. And next slide, please. So for the nutrition, the infant is still breastfed and bottle fed. So the breastfeeding frequency is at least 8 to 10 times a day, and the demand is 3 to 4 hours with a strong sucking strength. So there are no problems in her breastfeeding. Then next, if the mother is not around or if she is away from work, the bottle feed her with a formula which is hypoallergenic, since she already encountered an allergy from the food. The physician suggested that they bottle feed her with the hypoallergenic formula. So her food preferences include smashed squash, potatoes, bananas, and the likes. So she eats about 1 to 2 times a day with meals with snacks on the sides like the Marie crackers, since it can easily melt inside the baby's mouth. So during the assessment also, we noticed that she has already 2 teeth sa baba, which is the 25 and 24 central incisors. And when asked when was the onset, the mother mentioned that she started to notice the teeth around 7 months. So next slide, please. Oh, wait. Balik day. Sorry. So for the elimination, her bowel movement is twice a day with a consistency of watery with a color of a yellow stool, and the amount is a large amount. So the mother also mentioned that she changes her diaper at least 7 to 8 times a day due to her urinating or defecating. And so far there are no problems with diarrhea and problems like that. The next is activity and sleep. So she sleeps around 9 p.m. and wakes up at 7 a.m. and she also takes 4 naps a day, approximately 4 naps a day, and approximately she sleeps about 12 hours a day. But she also has a problem. Sometimes she has a problem sleeping at night, since she wakes up late from her nap. So we also gave the caregivers health teaching, which will be expounded later. So her rituals include peck, the one that you pat the baby to make them fall asleep, and breastfeeding. Then her daily activities include shouting, watching Cocomelon, playing, sleeping, eating, and she also enjoys playing with her siblings and with her toy, which is a rattle. So for the growth and development that we call on Christine Concepcion.
Thank you, Ms. Barroso. So for the growth and development, we measured the height, which is 72 centimeter, and we asked the mother for the weight since we don't have the weighing scale. So it is 8 kilogram. The head circumference is 44 centimeter, and the chest circumference is 45 centimeter. We are not able to get the abdominal circumference since the child started getting fidgety. So for the cephalocaudal appearance, she is a well-nourished and groomed child. The body temperature is 35.5 degrees Celsius. Pulse rate is 119 beats per minute. The heart rate is 121 beats per minute, and the respiratory rate is 36 cycles per minute. It is important to conduct an inspection on the child to detect abnormalities, including physical assessment. So for the physical assessment, for the skin, her skin is smooth with good turgor and is warm. Nails are trimmed. And according to her mother, there are Mongolian spots on her buttocks area. So for the head is symmetrical, scalp is unblemished and doesn't have lice. Hair is soft and distributed normally. Her anterior fontanelles is still open, and it usually closes around 9 to 12 months. She was able to show expression on her face and was able to smile and cry symmetrically as we observe. So for the eyes are symmetrical and eyebrows are straight. Eyelashes are uniformly distributed and curled outward. Cornea is shiny and clear. Sclera is white and her iris is colored black. So for the eyelids, it is clear. Conjunctive is somewhat pink. There is also a blinking reflex when we get the object near her face, and the eye moves in concert, which means when the left eye moves to the right, her left eye also moves to the right. So for the ears, pinna are symmetrical. She has minimal cerumen in her external ear. And she had good hearing since she was able to look at us when we called her name. So for the nose, it was symmetrical and we observed no discharges. For the mouth, lips are symmetrical in shape and it is moist. The tongue is midline, and in her teeth, two lower central incisor have already appeared. Gums, mucosa, and palate are pinkish, and she was able to chew and swallow as we observed. So next is the neck. Ovula is located in the middle. Mucosa is pink, and there is a positive gag reflex according to her mother. So for the breast, there is no masses and no discharge in the nipples, but the nipples are inverted. But it is common and normal for infants to have an inverted nipples. So the axilla are free from rashes as well. So for the chest, lungs, and thorax, thorax is symmetrical. The spine was free from tumors. Respiratory rate is regular. So for the heart sounds is audible via the stethoscope. Rhythm is regular. Respiratory rate is 36 cycles per minute. And the heart rate is 121 beats per minute, and the pulse rate is 119 beats per minute. For the abdomen, there were no visible masses. There is no lumps. There is normal bowel sounds, and the bladder is non-palpable, and there is no tenderness in the abdomen. So for the genitourinary system, so we only asked this from her mother, and according to her, there are no problems in the reproductive system. There is also no pubic hair, and there is no lesions around the area. So for the musculoskeletal, so muscles are symmetrical and there is no presence of paralysis or deformities. Arms and legs are also symmetrical and there is no swelling found in the assessment. So for her personal hygiene, in the general observation, we observe that she is well groomed and in a neat clothes when we conduct the assessment. According to her mother, when changing diapers, she uses wipes to clean the baby and use baby powder. She would change diaper for 7 to 8 times per day. For cleaning the ears, she uses cotton buds and she baths her child once a day, usually in the morning. And she always washes the hands of the infants before and after the meal. So after the meal, she would clean the tongue of the baby using the silicone soft finger toothbrush, the one where you put finger. Since she only has 2 small teeth. She would dress the infant 4 times and before going to bed. We observed that the environment is hygienic and well ventilated. So practicing proper hygiene is necessary for the growth and development of the child. So for the reflexes, she has plantar grasp reflex. We tested it by placing a finger or our thumb behind the toes and she grasped it by flexing her toes. She also has Babinski reflex. We tested it by firmly stroking the sole of her foot and the big toe moved upward and the other toes was flexed or flex. She also has blinking reflex as we tried to get the pabalik po ako sa slides. So this we tried to get the object near her face and she immediately blinked. These are all indicator of development and functionality of the nervous system. So for the language development, they uses Bisaya and Tagalog as their primary language and the infant is responsive to both language as we also observed. According to her mother, she can also say mama, dada, and baba and likes to make gibberish sounds. These are all normal in the developmental milestone of a 9-month-old infant. So for the conclusion, Ms. Barroso.
So for the conclusion, so this is just a summary of our conclusion. So next slide po. So next slide, please. So our client is a 9-month and 23-day-old infant during the time of the assessment. So in the MMDS3 result, all in all, we administered 30 items, 6 from the personal social, 6 from fine motor, 7 from language, and 11 from gross motor, in which she passed 18 items and failed 12 items. Although she had failed 12 items, it did not indicate that she has a delay since those items are of higher age and can still be developed by the child. And during the assessment, the client was in a calm state, which made it easier for us student nurses to assess. And also she was shy at first, but then we established rapport, and that made the client and the mother comfortable with us. So let me call on Christine for the growth and development theories relating to our manuscript.
So we observed and concluded that these lines, the behavior of the child lines with Erik Erikson's trust and mistrust stage, where the child is dependent on her mother and the mother of the client is being there to give assurance and meets the needs of the child. It also connects to Sigmund Freud's oral stage, where the client keeps putting things in her mouth during the MMDST assessment, such as the cheese curls, blocks, and the balls. It also coincides with Jean Piaget's cognitive theory, where the child shows to have plantar, Babinski, and blinking reflexes. She can also respond to sounds and is curious to her surroundings. She also likes to play peekaboo, which allows her to develop object permanence, and lastly, experience stranger anxiety because she keeps on seeking her mother and would not separate from her when we first arrive. So all these behavior are normal and proper for her age. So Ms. Barroso?
So during the assessment, there were no abnormalities starting from the neonatal down to the language development. So the student nurses gave the caregivers health teachings. First, we suggested that the infant must take a lot of vitamins, minerals to boost her immune system. The next is, since the patient has trouble falling asleep at night, since she wakes up late from her nap, so we advise the parents to adjust the nap length of the child and to adjust her sleeping schedule. Then next, since the patient still can't walk yet, we advised the mother to do a morning exercise to promote the ability of the child to stand and to walk. The next is to interact with their surroundings. We advise the caregivers to go outside so that the baby can interact with her surroundings, and it is also safe to go outside their neighborhood since there aren't a lot of people going outside. Then next, since the child still can't imitate speech sounds, we advise the parents to talk to their child more and to have conversations, to play talking games such as imitating her words, so that it develops the child's ability to talk, or to imitate speech sounds. The next is about, we forgot to put it in the manuscript, but we also gave the health teachings about the immunization, since she wasn't still immunized with the IPV and the MMR. So we advise the parents to get her vaccinated because it's for her own protection and for her own good. So that's all about the health teachings. Then through this assessment, the student nurses realized that we realized a lot of things. Number one, it is hard. It's difficult in handling children, especially infants, since they're easily distracted with their surroundings. It takes a lot of knowledge, takes a lot of skills, practice to handle them. And number two, it is important, the MMDST is important to conduct so that we can identify early, so that we can detect early if she has any developmental delays, and to take action if there are any. It is evident that we met our goals. We were able to establish rapport. We were able to collect needed information to perform the cephalocaudal assessment. We were able to administer the MMDST, and also we were able to give them health teachings to promote the growth and development of the child. So during through this evaluation, through this assessment, this will help us improve to be better student nurses in the future. And this manuscript also, what makes our manuscript also interesting is that it is an infant, so us student nurses, this is our first time dealing with children, especially infants. So that's why for us this manuscript is interesting. And also we hope to use our knowledge about their findings, our experiences. We hope to use this knowledge and experience not only in the hospital setting, but also in the other settings like the community, the home, and also we hope to use this to deliver the utmost, the best care for our next infant age client. And that's all for the infant presentation. Thank you.
Present your age line here.
Okay po.
All the photos, unahin mo muna yung photo para meron kang evidences that you have this client. Dapat na-present ang reference, lahat mapakita. Okay, the next reporter, be ready. You can start with your presentation. Pero pakita muna sa amin yung age line tsaka yung mga videos, photos ng inyong infant. Wala pa.
Di na pa-present pa naman sa presenter po.
So just want to see ano ang natamaan sa age line. 'Di ba? Ang dapat matamaan sa age line, yan yung i-present. So in your personal, ano lang yung dapat ma-test sa patient?
Ano po, ma'am, please, pat a cake po.
So meron pa siyang konti. And then dito sa ilan?
Neat pin, 3 po, ma'am, neat pins grasp and yung thumb finger grasp.
Okay, and then 2 sa sa baba is ito lahat sa pinakalas.
Opo, ma'am, 6,
Okay.
ma'am.
Sige. Balikan na natin mamaya. We're going to you show your video or pictures of your client references. Dito na, idiretso nyo na lang dito. Group the next reporter. Okay, the next reporter, I don't want you to read. In you present the result and interpretation, and doon sa PA, i-highlight yung mga problem. Pag wala, you can, I'm going over with the manuscript, so makita ko naman. So yung i-highlight lang natin sa PA yung may mga concerns. Yan lang. Walang photo na iba. Sige. Kung wala, then we're going to proceed with the next client, the toddler. May na ako mag-question Concepcion and Barroso. I-prepare niyo lang yung yung PPT pa rin. Okay, may we call the next reporter, introduce yourself.
Marinig po ako, ma'am.
Mm-mm.
So, good morning, everyone. I am Rana VNB Rubio. I will be discussing today about the toddler. I will be starting from introduction up until to the fine motor adaptive of administration of MMDTS. So, next slide, please. So for introduction, toddler are generally thought of as children between the age of 1 and 3. And by certain age, most children can perform developmental milestones. So toddlers were will tend to move around, and they are more conscious or curious about their surroundings like that. And their curiosity about unfamiliar things, objects, or people, it also becomes more deeper, or it is growing as well as time goes by. So toddlers become more independent. They start to act defiant, and they start to imitate other people's actions, especially the older one or the other kids, or they can now identify themselves in the mirror or photographs, and they can now recognize the names of well-known people or objects or such animal, and they can now put simple words or phrases together and can follow simple direction. So again, toddlers are children between the age of 1 and 3, and are classified as being in the second stage of Erickson's developmental theory or stage, which is the autonomy versus shame and doubt. So according to Erickson, children at this age are focused on developing a sense of personal control over personal skills and a sense of independence. So children uh, can probably have the urge to carry out a task on their own, such as they can choose what to wear, they can choose what to eat, they can dress themselves, and they start to imitate actions of others, play with their own toys, or play with other children, or even they can go pee with their own. And as for MMDTS, it is a Metro Manila developmental screening test that detects delays in children in 2 weeks to 6.5 years old. And sectors that are included are personal, social, fine motor, adaptive, language, and gross motor. So as for our statistics, we only have found the national one, which is in the Philippines, 30% of children under 5 years of age were generally or greatly affected by diseases. So in that, Department of Education marks the Global Hand Washing Day in celebration of the year 2022. So expert has also emphasized in this part that hand washing can contribute to the reduction, elimination in the stunts of children. So as for our client, he is a Filipino toddler with the initials of NPC, who is a 2-year, 5-month, and 20 days old child who is currently residing in Purok 5, Kilometer 10, Catalunan Pequeño, Davao City. So we have him as our client since he was able to met the criteria that we're looking for as a toddler and for us to assess and examine. So fortunately, it is somehow related with our co-student nurse. That is why it is easier for us to assess and do the interview that was held last October 15, 2022. So as next slide, please. So as for our general objectives at the end of the assessment of MMDTS, the interview and physical assessment of toddler, the student nurses will be able to determine the toddler's growth and development. So as for our specific objective, next slide, please. So at the end of their 2-hour assessment to the client, the student nurses will be able to build rapport with the child as well as his mother and observe his behavior during the test or the interview or during the assessment. And then we have third, gather personal data from the client by asking or interviewing the mother or the parent. Then next is we have to administer all the MMDTS component that were age appropriate for the client. And next is perform physical assessment to the client. And lastly is we have to evaluate the physical language and psychosocial development of the client. So next slide. So as for our personal data, the initials of our client is NPC, who is a 2 years, 5 months, and 20 days old child. And his birthday was on April 25, 2020. And then his address is Purok 5, Kilometer 10, Talunan Pequeño, Davao City. And his nationality is a Filipino, and he is also a Roman Catholic. So he is second among two siblings, and his father's initial is JAC with the age of 32, and he is a high school graduate who is currently working as survey aide. As for his mother, CAC, who is a 30-year-old and with a college educational attainment of college level, and is currently a housewife. So next slide, please. So as for the computation of age, for us to be able to get the client's computed age, we have to get the difference of the date of assessment as well as the birthday of the client. So our date of assessment was last October 15, 2022. And as for the birthday of our client, April 25, 2020. So so since the day of the day of our assessment was 15 and the birthday of our client was 25, we are going to subtract it. So we have to borrow from the month of the date of assessment, since 15 is lesser than since 15 is lesser than 25. So we borrow from 10 months. That's why the month in the date of assessment become 9, and 30 was added to 15. That's why it become 45. 45. So 45 minus 25, it becomes 20. So that is our computation for the days. As for the month, since we borrowed a month so that we will be able to get the day, the 10 will become 9. So 9 minus 4, it becomes 5. That's why we have 5 months for the client's computed age. As for the year, we just have to simply minus the 2022 and the 2020, and that's why we have here the client's computed age of 2 years, 5 months, 20 days old as for the time, as the date of the assessment. So next slide, please.
Okay, for a while, what is your answer, group 2 and 3? So I will give you task group 1 and 3 para hindi naman kayo natutulog. What is your answer? Donaire. Kasi wala nag-send dito. Sa kagrupo niyo ba si Donaire? Hindi. Hindi.
Hindi po, ma'am.
Donaire, what is your answer? Okay, group 3. I don't want you to throw that computation because you're going to submit to me something while they are reporting. Okay, so I want you to take down notes. So that will be your first. No, so I will ask a copy of your notes later, individual. Group 3 wala. Continue, Miss.
So let's proceed with the administration of MMDPS. So the toddler is 2 years, 5 months, and 20 days old. So the test administered to the client that cover his age during the assessment are personal, social, fine motor, adaptive, language, and gross motor. So in total, there are 33 items that were administered, wherein as for the personal, social, so in this part, most of our tests were passed by report, since during our assessment, it is hard for us because in the beginning, the toddler was sleeping and having his breastfed, and then as we attempt to wake him up, he threw tantrums. So that's why we just have to interview his mother with this part. So next slide, please. So as for the personal social sector, in this test, we administered 6 items wherein 5 were passed by the child and 1 was failed. And as for the place in interactive game, in this part, the student nurses ask the mother if the child can play interactive games with other children, and the mother verbalized that mostly sa iyang ginadula kay kanang taguanay or tagaanay, and then she added that that mostly pod sa iyang kadula is iyang older sister o kanang mga silingan. And then as for the rationale of this, toddler starts to interact with their environment by playing interactive games with other children. So as for the uses spoon and spilling little, the student nurses ask again the mother if the child can use spoon in feeding himself, or if there is any spilling of food, how much does he spill. So the mother, this was passed by report, and the mother verbalized that makaya man niya og kanang kaon nga siya ra, pero naalang gihapon matagak nga gagmay nga kanon or sudan sa iyang plato. And then as for the rationale of this is by year or by the age of 1, it is common for the toddlers that they can eat or fed themselves. However, they can also at the same time they can also messily fed themselves with a spoon. So as for the washes and dries hand, so in this part the child was failed, since as the student nurses asked the parent or the mother if the child can wash or dry his hands alone, but the mother verbalized that the child cannot still but the mother verbalized that dili pa niya kaya niya maghugas, pero dili pa niya kaya magpauga-og na apay gamay nga mga sabon nga mga bilin. And then as for the puts on clothing, the mother as for the puts on clothing, this was passed